Okay, so you're going to start on your back with your knees bent and your feet flat on the floor. Take your hands to your rib cage and start to breathe in, expanding through the rib cage all the way around to the back. And as you breathe out, feel the pelvic floor lift, the abdominals contract toward the center, widen and flatten, and the ribs come down. Inhale, everything expands. Relax that pelvic floor. As you exhale, feel that lift. Feel this flattening and widening between the hip bones. Shoulders are relaxed. Feel the back expand into the mat. And take 2 more breaths. Now we're going to take one leg up at a time, meeting with both legs in tabletop. You're going to keep everything really engaged here. So feel that pelvic floor lift. Exhale, the rib cage is heavy, the sacrum is heavy, and then you pull that other leg up to meet it. Bring your knees in slightly just for a little bit more support, and then place your hands down by your sides. As you exhale, you're going to take one toe, dip it down toward the mat. Inhale the leg up and switch. Same deep breathing pattern. You're trying to get expansion in all directions in that rib cage. As you breathe out, you feel that pelvic floor lift. Feel everything tighten and flatten in the front. Let's take 2 more. And then place one leg down at a time, meeting with those feet flat on the floor. Take your hands down by your sides and press them gently into the mat. Take a big inhale, feel that expansion. As you exhale, feel that lift. Squeeze your butt, lift your hips up, and then inhale down. Lifting up, inhale down. Squeeze from the butt. Feel a magnetism between the knees. Don't let them splay out. Press through all 10 toes. Exhale up and lower and up and lower. Hold it up on this one. Lower halfway down and lift. Halfway down and lift. So you're feeling those glutes lengthen and tighten. Relaxing and squeezing. Knees don't move. So everything contracts, pelvic floor, abdominals. You're using that exhale and you're squeezing from those glutes. You have 3, 2, hold it up, hold. If you need a little rest, just tap your butt down, bring it right back up. You're taking little tiny lifts of each foot. You can place your fingers on the bones of your pelvis. You want to keep that level. Keep the hips lifted and keep them level right to left. Just little marches here is fine. If you prefer, you can place a band around your knees for this, but we're just taking the little tiny marches, not quite as big as before. Until you have about 6 to 10 on either side. If you feel yourself getting too fatigued and you're rocking back and forth, then you just lower down, come right up for a couple more reps. From there, you're going to switch over to all fours position. And we're going to try breathing here in this position. We're going to get this set up super well. So soften through your elbows. Find the tips of the shoulder blades around the armpit area and push the floor away from you from there. So this prevents this sinking down into the shoulders. You're pushing that floor away from the shoulder blades. Keep those elbows soft. Slightly lift the tailbone so you still have a lumbar curve. And then pull gently, that rib cage comes in at the bottom. So the rib cage and the pubic bone are connected. From there, you're gonna breathe in. Feel that back expansion, feel that lateral side to side expansion. And breathe out, feel the pelvic floor lift. So we're maintaining the position of the spine as you do this deep breathing, maintaining position of the rib cage. Even though they're expanding, you're not letting them drop. You're not letting the chest drop. You're keeping everything super connected. The elbows soft. Take 2 more breaths. Now we're adding movement. As you inhale, lift the head, lift the tailbone, let the ribs come down. Extension through the spine. Pull the shoulder blades back, pull the chest, collarbones forward. As you exhale, curl through the tailbone, dive down through the head and lift the rib cage, rounding through the spine. Inhale and lift the tailbone, coming back to that extension. Pull through your arms, keep those elbows soft. Exhale and curl. Exhale. Now feel that pelvic floor lift. Feel those low abdominals pulling up, trying to get some curving, opposite curving of that lumbar spine. So it's really easy just to focus on around the rib cage and thoracic spine. But if you bring some awareness to these low abdominal muscles, you can really get that curving, reversing the curve of the lumbar spine. Take 2 more. And then come back to neutral. Keep your elbows soft. Take your toes to the right and look over your right shoulder. You're side bending the right side of the body. You're opening the left side. You might feel a stretch along the left side of the rib cage. Breathe into that stretch. Exhale through center and switch to the other side. Toes to the left, head looks to the left. Breathe into the right side of the ribs and exhale through center. 1 more to either side. Breathe into that left side. Breathe into that right side. Now I'm going to walk my hands forward. They're still underneath my shoulders. I'm taking my toes, stepping each toe back. Coming into a plank position. Soften your elbows. Push through those shoulder blades. Soften your knees and lift your tailbone slightly. That rib cage is still connected. Hold there for a moment and breathe. Now take your right leg and step up near your right hand. Push down into your left hand and twist open to the right, keeping that left hip lifted. So we don't want to sag down like this. Keep your left hip lifted and push into your left arm. Breathe into this stretch. Bring the right hand down, step back, bring the left foot forward, push into your right hand, keep your elbows soft, twist, try not to dip down, lift that right hip. Breathe into it, and exhale, come down. Left back, right foot forward, and twist. Bring it down, right foot back, left foot forward, and twist. Bring both feet back, lift your hips up into a downward dog position. The shoulder blades are down the back. The heels are reaching back behind you. The tailbone is reaching up toward the ceiling. Take a breath or 2. And then walk your hands back towards your feet. From here, plant through all 10 toes. Soften your knees. Keep your knees soft. Pull up through the low abdominals and start to roll up, stacking the spine bone by bone. Reach up toward the ceiling, take a little extension. Now we're going to roll down, take the head first and start to roll through the spine like you're peeling it off an imaginary wall. You still have soft knees, planted through all 10 toes, lifting through the abdominals and rolling up. Feel that lift. And here in standing, just finding a bone stacked aligned position. from which you'll do a lot of your postural core exercises and standing, and as well as starting your squat exercises. So plant through all 10 toes, soften those knees, allowing the rib cage to come in and down. So if we're in a locked knee position, if we hyperextend, you're most likely going to be extended through your spine, flaring through your ribs. So first, plant through your feet, soften your knees, feel your weight over your arches, and feel how that automatically makes the rib cage come down. And then see if you can find just a little connection, pubic bone to rib cage. Slight lift of the pubic bone, slight down tilt of the rib cage. So we don't want to lean forward, but it's just a connection, a muscular connection. You can even use an exhale here and feel that connection.